Inhale for 1, 2, 3, 4, 5. Hold. And now exhale for 1, 2, 3, 4, 5. Now in this video, we're going to imagine that we are a fresh breath of air that is being inhaled through someone's nostrils. We will follow this air throughout the respiratory tract. In this first video, we will be looking at the upper respiratory tract. The upper respiratory tract consists of the nose, nasal cavity, sinuses, and the pharynx. Let's hemisect the head in order to better visualize these structures and relate them to their respective functions. Most of the respiratory tract is lined with ciliated, pseudostratified columnar epithelium, also known as respiratory epithelium. This epithelium is unique to the respiratory tract. There are lots of goblet cells that secrete mucus to help lubricate, humidify, and trap any pathogens or debris that is inhaled. Additionally, the apical surface of the cells have cilia. The cilia serve to sweep that mucus towards the pharynx, where it can be swallowed and exposed to acids and enzymes in the stomach. The best way to learn the respiratory anatomy is to follow the pathway of air from beginning to end. So to start, we will start with the nose. Air will first enter through the paired nostrils referred to as the nares. The nares open into the nasal vestibule. In the nasal vestibule, you will see the coarse hairs that trap sand, dirt, and even insects from entering into the nasal cavity. Once the air passes through the vestibule, it will enter into the nasal cavity. The nasal cavity is separated into right and left sides by the nasal septum, which is composed of the perpendicular plate of the ethmoid bone and the vomer. In the nasal cavity, we will also see 3 bony projections. These are the nasal conchae, also referred to as the turbinate bones. We have the superior, middle, and inferior nasal conchae. In between each, we have superior, middle, and inferior meatuses. When air is inhaled into the nasal cavity, it bounces and churns through the turbinates, which allows small dust particles and pathogens to come in contact with the mucus and become trapped. This also humidifies and warms the air, so it will not dehydrate the rest of the respiratory tract. As we exit the nasal cavity through the internal nares, we make our way into the pharynx. The pharynx can be broken down into 3 separate components. The superior-most portion is referred to as the nasopharynx. In the nasopharynx, we can see the opening of the auditory tube, the pharyngeal tonsils, and part of the soft palate. The second part of the pharynx is the oropharynx, which is shared by the digestive system and the respiratory system, since it's located directly posterior to the oral cavity. In the oropharynx, we will see the posterior portion of the soft palate called the uvula, which dangles between the 2 pharyngeal arches. As we leave the oropharynx, air is channeled into the lower portion of the pharynx, which is called the laryngopharynx. Air will leave the pharynx and pass through an opening called the glottis in order to make its way into the lower respiratory tract. Take another deep breath. We still have a whole lot of air tubes to cover. Thanks for watching. For more educational videos, subscribe to the West Coast University channel below.